Assalamu alaikum. Hello dear residents. This is our second station. In this video I'm going to teach you how it's a teaching also station, but reading, like interpreting any lab investigation, chest x-ray, ECG, how to approach and how to conclude the OSCE station. So for here I have an example. Teach a medical student how to read a chest x-ray. And then, as I mentioned in the previous video, all of your stations, you will have to answer post-encounter questions, and you should be ready for that. So, for here, I just put an example. Like this is a chest X-ray. Usually this is something similar that you might face in the exam. Let's go throughout the scheme of teaching reading OSCE station. So first of all, you should greet and introduce yourself. So for example, hello, I am Dr. Farah. I'm the senior pediatrician covering the ward today. And then break the ice, mention anything, just any sentence. How are you liking the residency area, the residency program so far? Are you interested in the pediatric rotation? Just any sentence to just break the ice before starting your station. And then just mention in our station, he's a medical student. So just mention, have you seen it before? This would give you a starting point where you might start your OSCE station. Also, just make sure you always repeat for the medical student, or if he was even a resident, always mention that you can interrupt me at any time, and am I clear for you? You can ask any questions. And then just mention the indications. So usually, why do we do this, for example, blood test? Why do we do the X-ray? Why do we need an ECG? Get him involved. Let him answer your questions and help him with the questions that he cannot answer. So you would start with the personal data. Don't forget anything. For example, here we have a chest X-ray. Don't forget to mention the personal data. Make sure this chest X-ray is correct for our patient. The name, the date, the time, when was the chest X-ray taken. And then you would start with the musculoskeletal abnormality. So just mention if there is any musculoskeletal abnormalities, there is any fractures. After that, just mention about the lung field. Is it hyperinflated? There is any abnormalities like pleural effusion or any collapse. And then mention the cardiac shadow. If it is more than 50% of like there is any aspect of cardiomegaly or not. And then if there is any other abnormalities, as I mentioned, if there is any effusions, if there is any collapse, any tracheal deviation, you should also mention that. So this is just an example. This is for an X-ray. So you would go through it the same as any teaching, any reading procedure. You would go throughout the first steps, and then you would comment about any abnormalities that's seen in whatever the data is given to you. And then next time you teach how to read, you have to mention this point to the resident or the medical student, that next time you will teach how to read the data to another medical student or another resident. And then at the end, as all teaching OSCE stations, make sure that you leave the resident or the medical student with a topic that he have to prepare for next day. So for example, in our station, I just wrote an example for you. I'll give you a topic about pleural effusion. You can mention, just prepare a slideshow mentioning what are the causes of pleural effusion, or whatever comes to your mind during the exam. And then, as I mentioned, all OSCE station usually you will have post-encounter questions, so make sure that you are ready to answer any question that might face you in the exam. So for here, just for example, I wrote, what is your diagnosis? As you can see, it's clear that there is a pleural effusion covering the right costophrenic angle. And then also outline your management plan. Outlining your management plan, you have 3 pathways you should concentrate on. It's either an emergency, so you should state exactly your PALS steps, or either it is a management plan, someone stable in the ward, so you just have to mention your MR12, exactly what you write in your MR12, you have to mention it. Or if it's a counseling station and they ask you about the management plan, you just have to mention what we call the magic word. It's a multidisciplinary team, and mention all the subspecialty that might be included in your management plan. So this trick, I just wanted to mention in this station, the trick of answering the question about outlining your management plan. Just make sure you don't forget these 3 steps. It's either an ER management, you outline your PALS, or it's either a stable patient in the ward, you just outline your MR12, or it's either a counseling station, you outline your multidisciplinary team. Thank you.